Hi, my name's Bob Harrington from Stanford University, and I have the privilege of being the American Heart Association president. We're here at Scientific Sessions in Philadelphia, and I'm joined by my colleagues, the chair of Scientific Sessions Programming, Dr. Lloyd-Jones from Northwestern, and the vice chair of Scientific Programming, Manesh Patel from Duke University. Welcome.
Thanks, it's great to be here. We've got a really exciting session in store for people, and I think, Saturday is going to be the day we get it all rolling.
Well, having been a former Scientific Sessions chair, it's sort of this relief when it gets here. How does it feel?
It feels great. As you know, this is the result of a year-long process. I have an amazing partner in Manesh and literally hundreds of volunteers helping put this program together, as well as the amazing AHA staff.
I'm glad you said that, because it really is the amazing AHA staff that brings it together.
It's a privilege, right? It's a privilege to be part of the team of all the people and all the science that's at this sessions, but it really is a culmination of year of work that a lot of people have been doing.
Well, on behalf of the AHA, thank you both, because I do know how much work it is, and having walked around the convention center all day today as it's still in the process of getting ready, it's pretty exciting to be in Philadelphia.
Absolutely. First time in Philadelphia.
First time in Philadelphia, one of America's most historic cities, but the first time we've been here as an organization.
Exactly. It's one of the themes we thought about. If you're coming to the American Heart Association and you're in Philadelphia, we wanted to sort of celebrate the fact it's the first time. So you'll hear about things.
So we're going to get into some of that fun stuff. So let's start with day one, Saturday, the opening session. There's some pretty cool stuff.
Yeah, so opening session kicks off at 8:30 Saturday morning, and there's going to be a couple surprises there, as well as you're on a panel with Nancy Brown and Rob Califf and Jess Mega talking about health tech. And I think that's going to be a really good kickstart, because so much of the meeting is going to focus on health tech and health innovation. That'll lead right into our cutting edge session, where we're going to hear about gene therapy, about using bubbles for therapy, and all the way to behavioral economics to try to bend the curve on the obesity epidemic and other problematic behaviors.
Yeah, I love the breadth of what we're going to talk about in the opening session. As you say, there are some exciting announcements as well, so don't miss it.
Exactly.
Manesh, a lot of great late breakers at this meeting, and Saturday, tell us about it.
It's a blockbuster day, and as you said, one of the best things about the scientific sessions are the late-breaking trials. They're wide and broad, but maybe the session I think everybody's going to be really packed into is the ischemia trial session, where after 10 years, and I know you're aware of it, there's a large randomized trial, actually two randomized trials, patients with ischemia undergoing medical therapy versus an invasive management strategy, and then also the same types of patients except with CKD. Quality of life outcomes, case, a big panel. I think there's going to be a lot of people really interested to see how this trial turns out.
Yeah, I mean, as you said, I am a member of the executive committee, and I remember the first notice of award was 2011.
Yeah. First
patient randomized in 2012. So this has been a journey for one of what I think is the most fundamental questions in general cardiology. In your patient with angina, with an abnormal stress test, what do you do?
Yeah. I think it's going to be central. We've been thinking about this for our practice because we see variation, we see a lot of opportunity to improve. And over time, we've seen Orbita, we've seen Courage. So we're going to start to see with the world of new medical therapy and intervention, what can we do?
So I know that you must have had a lot of conversations as a planning committee. You gave ischemia a whole session. How'd that conversation go?
That was an interesting conversation, but as I think we've said, this is really a game changer. Positive, negative, neutral, but with quality of life outcomes, it doesn't matter. I think we're going to learn a whole lot from this trial, regardless of what the findings are, and that's when the conversation starts. It doesn't end.
Yeah, and I think that's exactly right. And I think the other reason people come to sessions is they want to hear about the trial. You can read about studies, but you want to be in the place, in the room where people are talking about it, analyzing it, understanding it. And so I think, as often is the case, this is about the conversation that's going to happen and in the interpretations.
So, to steal the DLJ Twitter hashtag, you got to be in the room where it happens.
Yeah, that's right.
And that's going to be a theme, I understand, throughout the weekend.
We'll get to that. Absolutely.
All right, so I go to ischemia, I go to the opening session, I'm a little stressed out, I'm trying to figure out how I'm going to spend the rest of my day. What do I do next?
Bob, between sessions, here's where you can find me. We have a puppy snuggle zone because there's good evidence that snuggling a puppy will lower your heart rate and lower your blood pressure. So if you're having a little trouble with sessions, feeling a little stressed out, check out the puppies.
I bet Bob's been snuggling with puppies for years.
Where are those puppies going to be?
Yeah, so it's right at the junction between the Grand Hall and the main concourse.
So actually in the convention center.
Yeah, you can't miss it.
And you can adopt one.
So if you really bond during those moments of blood pressure lowering,
yes,
that could be for you.
Take that puppy home.
You know, I have both my daughters and grandchildren here with me this week, and I'm
Keep 'em away.
Find out how many
Beware.
dogs we can take home to San Francisco, right?
Beware. Exactly. Exactly.
Anything else on Saturday you guys want to talk about? Anything that's really got you excited?
Yeah, you know, I think one of the other late breaker sessions is thematic of what we saw this year in terms of the submissions, and I think this is really exciting. We are seeing brand new ways to treat risk and to lower risk for cardiovascular disease. So in late breaking session 1, using an SGLT2 inhibitor in non-diabetic patients to prevent heart failure. This is the DAPA-HF results in the non-diabetics. We're also seeing colchicine repurposed to use in MI patients for the first time. So those are results I'm really excited to see. Also, a protein called apobetalone, which is a modifier of the epigenome used in ACS patients with diabetes. So that kind of theme you're going to see all through the meeting, but these really cutting-edge types of therapies coming directly out of genomic work and directly into translation much more quickly than we've ever seen.
Yeah,
before.
I'd say just like the HA, so the biology, the translation to patient care, and it's happening faster. And for us, I think it's also personalizing more. Yeah. So we're going to see that throughout the meeting.
Yeah, and I like the idea of personalizing therapies, and I like the idea of repurposing old therapies because they might have a benefit that wasn't initially thought of. And the SGLT2 story is fascinating. We saw the overall data earlier this summer, but now we're going to see an anti-diabetic drug not in diabetes patients.
Yeah.
Wow.
Yeah.
And the colchicine story, there's been a lot of small studies which taken in total is kind of interesting, but this is a big study.
Yes,
Yeah.
exactly.
So it should be a great first day.
Yeah.
All right, anything else you want to talk about this first day?
You know, I'd say just wrap up the day after you've snuggled the puppies. There's a really nice all-council reception that everybody should make it to, and you'll be there actually talking about some new HA initiatives.
We're going to talk about some new HA initiatives. This is really a request from our councils that, look, we go to our own council dinner, but we don't get to mingle with all of our colleagues across the 16 councils. So we're trying it. We're going to have an all-council reception. I learned all about Philadelphia's history of the mummers. So we're going to have some exciting local culture and hopefully a good chance for people to network and mingle and talk science, but also just to have some fun.
Great.
And then come back for day 2.
Day 2.
Stay tuned. Thank you from Scientific Sessions, and we look forward to bringing you the next session on day 2.